For decades, we've trusted our bad LDL cholesterol number to gauge our heart attack risk. But what if that trust is misplaced? A staggering 75% of heart attack patients had LDL levels considered normal. The problem is that standard tests are dangerously incomplete. They only measure the total weight of your cholesterol. That's like judging traffic by total weight, not the number of cars. A few trucks can weigh the same as 100 cars. Next, we'll expose what standard tests miss, reveal the markers that truly predict risk, and show you how to see the full picture. So, where does the standard lipid panel fail? It starts with a flawed calculation for your main LDL number. Most labs don't measure LDL directly. They estimate it with an old formula that can be wildly inaccurate if you have high triglycerides. This creates a dangerous blind spot called discordance. Your calculated LDL can look fine, while your particle count is dangerously high. Here's the key shift in thinking. It's not the amount of cholesterol that matters most. It's the total number of damaging particles. And not all particles are the same. Particle size is another vital detail standard tests completely ignore. Think of them as either fluffy beach balls or small, dense golf balls. These small, dense LDL particles are far more dangerous. So if LDL-C is a flawed estimate, what is the single most important number you should know to determine your heart attack risk? Before we reveal that number, you should know that a primary cause of these dangerous small particles is insulin resistance, the precursor to diabetes. The answer to the most important number is apolipoprotein B, or ApoB. Think of it as a barcode on every single dangerous particle. Every single particle that causes plaque, LDL, VLDL, IDL, carries exactly one ApoB molecule. It's a direct, accurate particle count. Okay, ApoB solves the particle counting problem, but what about risks that are completely invisible on a lipid panel? First, there's lipoprotein A, or LPA. This is a highly damaging particle, almost entirely determined by your genetics. High LPA elevates your risk even if all other numbers are perfect. One test can tell you your lifelong inherited risk. The second hidden danger is inflammation. Hardening of the arteries isn't a plumbing issue. It's an inflammatory disease. One of the most powerful markers is myeloperoxidase, or MPO. It signals that plaque in your arteries may be unstable and at risk of rupturing. In fact, MPO testing can identify up to 40% more people at risk for a heart attack, even with normal cholesterol. We've covered a lot of new markers. How does knowing this change things? It moves us from generic advice to personalized medicine. Remember that 75% of patients with normal LDL? Now we see their hidden story: high ApoB, small particles, or silent inflammation. This level of detail is particularly needed if you have diabetes, hypertension, or a family history of heart disease. This information also refines treatment. Knowing your particle number helps a doctor decide which specific medication and dosage is right for you. It also empowers your lifestyle choices. Exercise doesn't just lower cholesterol, it can change your particles from small and dense to large and fluffy. So let's put it all together. What does a complete risk profile actually show you? It's a dashboard, not a single number. You look past the flawed LDL-C and focus on your true particle count with ApoB. Then you add your genetic risk from LPA and your real-time inflammatory status from hsCRP and MPO. Each marker adds a unique detail. This complete picture allows you and your doctor to move beyond generic guidelines to a prevention strategy built for your unique biology. A standard lipid panel is like a blurry black and white photo of your risk. Advanced testing is a high-definition video. The technology to see your true risk exists right now. It's time to demand more than just the basic numbers. Talk to your doctor. Ask specifically for advanced lipid testing. Ask for your ApoB, your LPA, and your particle size. This is not about replacing the standard test. It's about upgrading it to get the accurate assessment you deserve for true prevention. Your heart health is too important for an incomplete picture. Don't settle for normal. Be man to know your true risk.